No, it's fine. I mean, relationship is important because a lot of the stuff is about stakeholder engagement, identifying who they are. One interesting thing for me is I was a UK trained doctor, now in the German medical system. It's finding those contacts, building those relationships, understanding a system which functions in quite similar ways, but in sort of key differences from the system I trained in. So really, yeah, relationship building, being able to listen, empathize, and communicate has been a very important aspect of the last few months of building the company. The other thing, so we said about values, the other thing we also very early on decided on is that we're going to be a very clinical, medical focused company. We are going down the route of developing a regulated medical device, a digital therapy, and we're, in 2022, we'll be getting our certification, our CE mark for that. But what that means, of course, is that we launch straight into gathering clinical evidence. So over the last few months, we've conducted 2 studies. Building on the product, going from proof of concept to something that actually has an impact. And we've been really pleased to see that, even after our most recent study, we are able to change people's glycemic metrics, improve people's glycemic metrics for our patients with type 2 diabetes, also massively improve certain metrics of well-being. So increase concentration levels, improve energy levels.
How do you recruit for those studies?
We've had 2 routes of recruitment. One has been through these collaborations with diabetologists. So diabetologists who understand and know our recruitment criteria, feel that people might be eligible, and send them our way. And also social media. So we've gotten permission from the moderators of various groups on, for example, Facebook and other platforms where people with type 2 diabetes are. And again, with permission, always doing things in a collaborative way, saying we're starting up this program, we're running it as a clinical study. Would you like to take part? Please sign up here. And, very much clinical study focused. We go through a proper consent process. The data is obviously treated with the utmost respect, in line with regulation and in line with sort of the best principles around dealing with health tech data. So, so we've taken the view that we are a tech company, but we're a medical focused and medically driven tech company. And therefore, we're going to bring the best practice in developing a new medical intervention into tech, basically.
Sure. Well, that actually brings us on to the tech. So previously, we were talking about the relationships and roles between clinicians and developers or engineers. So again, what does good look like when the relationship works, and what does bad look like when the relationship does not work?
I'll start with the bad, maybe slightly sort of pessimistically, which is to say that when this relationship does not work, what you get is either a product which doesn't work, which doesn't deliver the clinical benefit it was intended to do, or it works but is not adopted because you've not convinced the people who are going to be using it, or it might be adopted by a healthcare system, but the end users, maybe patients, really don't like it, really find it difficult to use, and therefore it ends up not having the benefit. So the only way you can go through that process of meaningful development to make a difference, actual adoption and actual deployment, and then actual use and love really by user, because it makes a big difference to their lives, is in this collaboration between the technical side and the medical side. The technical side knows the technology very well, but knows enough about the medical side to know how to apply it, and vice versa. There has to be this interlinking, and that's when things go well, certainly. That you have a medical team and a technical team that's really co-develop, co-design together, co-ideate together. It's not a question of we're going to build this technology and then we're going to ask the doctors where we should apply it. That route would never work, basically. So yeah, so good is it's the only way to achieve meaningful impact here is to do this in a collaborative way between the, in fact, to even break down these barriers and not even silo them separately, basically.
Awesome. And you mentioned that obviously your co-founders, a lot of them had experience in products in particular and hiring developers. What advice would you give to doctors who haven't had experience in that and are building tech companies?
So I think, yeah, most doctors, as all the skills that we get in our medical training, there's a set of skills and a set of knowledge and sort of experience that you get, that you need for building, that you just don't normally get. So the first bit of advice I would have is, surround yourself with people who have either done it before or can put you in touch with people who have done it before. There's so much about the sort of network effect, learning from these people, that helps. And hiring, for example, speaking specifically about hiring, it's something which I had never done in any previous role before. Maybe I had done some interviews in my previous roles, but really developing a hiring strategy, understanding what the profile is of the people you want. All of that is something that we've been really lucky to have great advisors, and also my co-founders' previous experience to help guide. And I've learned a lot from them in the last few months, definitely.
Brilliant. And also for those listening, we are running a course in 2022. If you are interested, just make sure that you're subscribed to Medic Footprints mailing list, so we'll let you know a little bit more about that. So the next thing we really wanted to go on to was understanding doctors, to understand what the value they bring to health tech companies, whether they're part of the team or in the leadership element. So how would you summarize what doctors bring, particularly when you're building a health tech company, and how they can communicate that with their fellow team members, co-founders, et cetera, et cetera?